Oh, hello, everyone, and welcome to another edition of Ask NP Deidre with nurse practitioner Deidre Arms. She is incredible. She is with Aspire Wellness Integrative Health over out of Ohio, but she does have a telehealth practice that literally spans in many states across the US. So you definitely want to go to her website, aspirewih.com, and inquire within for additional opportunities to get a personalized approach to your presentation of whatever you might be experiencing. Today, we are focusing on the ladies in particular, and this is important for people with cardiovascular and vascular diseases, but even in general, even if you think you're the healthiest woman on the planet, this is incredibly important because we all go through menopause. I hear the moans and groans already. Yes. And so we're going to be talking about menopause and hormone replacement therapy. And there was a big announcement at this FDA expert panel that happened recently. Nurse practitioner Deidre was there. Why was this expert panel so significant?
So this panel really was set out to basically providers are helping the FDA understand why we need to remove the black box warning on estrogen products, and also to better understand so the public understands like the safety associated with the estrogen and the new studies. And so it's just an exciting time for women. An exciting time that I think is going to be beneficial. Just that we're being heard, women are being heard, providers are being heard who are in this space, and just understanding, like, removing the fear around estrogen.
Okay, so we should actually get into what exactly is this black box warning that's currently on the estrogen products, but also maybe touch on why it was even implemented, why this black box warning was placed in the first place following the Women's Health Initiative study in 2002, I think it was.
Yeah, so a black box warning on any medication is the most serious warning that the FDA puts on a medication package. And so for estrogen products, it really warned about increased risk of breast cancer, heart attacks, strokes, and blood clots. And so this warning came after that WHI study, which with that study, when they interpreted it the way that they did, it sent shockwaves through the medical world because everybody was under the impression that hormone replacement therapy caused serious health risks. And the thing is that WHI study was kind of a one size fits all study. It mostly looked at older women using forms of estrogen that were synthetic estrogen. So it wasn't the personalized or modern approach to the way we use estrogen today. And so we've spent, since 2002, it was a rapid decline in the use of estrogen. And we know that estrogen is so cardioprotective. So we have implications for cardiovascular and bone health with estrogen. And so here we are, this many years later, almost 30 years later, with still a decline of use of estrogen, yet the new studies and the way they reinterpreted and looked at the WHI again shows that there's benefits to estrogen, yet the black box warning has been there this whole time.
Yeah, I'm almost wondering, just based on what you're saying, if there has been a study on the correlation between the decline in estrogen use and the increase in heart attacks in women. I'm
Uh,
not sure. I haven't even looked it up, but that would be really interesting to see if anyone had done anything on that.
Actually, there are a lot of studies coming about that and understanding. That's where we get into the whole hypothesis of loss of estrogen after 10 years. That's when we start to get into the risk of cardiovascular disease. So timing of when people go on HRT is really important, especially
So
for vascular.
So if the FDA is removing the black box warning from estrogen, how might this actually change? Do you think it will change, or how much do you think it'll change prescribing patterns for women experiencing moderate to severe menopause issues?
So I feel like removing the warning could open the floodgates in the best way possible because it's going to empower more providers to prescribe HRT without this fear. When we have a black box warning, there's an underlying fear like, am I going to cause one of these issues with my patient? I mean, it's the strongest warning you can have on any medication. And so it's going to remove that stigma that is associated with estrogen, and it could help shift our culture around menopause care and from caution and avoidance to thoughtful individualized support. So providers who've been sitting on the fence may finally feel more confident in offering HRT as a frontline therapy for patients, and I feel like we're going to see a lot of benefits in doing that.
Would you mind painting the picture of the current accessibility and insurance coverage for estrogen formulations and delivery? I don't know what that looks like right now, and I'm wondering if we need to how that's going to change, going forward, or if it needs to change going forward.
So, in the realm of bioidentical hormones, which is the hormones of estrogen that is more like the body naturally makes, we do have a few FDA approved products, but with the black box warning. So, in that YouTube that they did from the FDA, there were providers that were even speaking of like a woman who ended up being hospitalized in ICU and needed vaginal estrogen, not for hot flashes, night sweats, but because there's issues with when it comes to the vaginal flora, there's issues with urinary sepsis that can happen when we don't have enough estrogen vaginally. And so even the nurses and the providers didn't want to give this. None of them knew about it, knew how to give it. So that's like in our hospital settings, like people don't know how to give estrogen and they're worried about, causing somebody a stroke, even with those vaginal formulations. So that was a compelling story. But currently, like, you can go to your GYN or one of your providers, and if they're not comfortable with that, then you're left like having to seek out other providers that may give, hormone replacement. And there's not a lot of us that are giving HRT and assessing women. And then when it goes further, like even looking into things like testosterone, it's not even just estrogen, testosterone. There's no FDA approved dosing for women, yet we make this hormone naturally. So there's a lot to be considered. So currently, things are having to be compounded by compounding pharmacies. Not all of them have a consistent dosing. You don't exactly know if the dosing you're getting is what it reads on the package. Most of them are really good compounding pharmacies, but that's a concern as well. And patients are having to pay cash for these instead of getting them covered through their insurance. So there's just a lot when it comes to insurance coverage and accessibility for women.
It's interesting with our patients across the Global PAD Association's network, we find that a lot of women end up with the UTIs. And I'm wondering if that's a big contributor. And wow, that's incredible. So this could really change and improve things for so many patients. I mean, I can't tell you how many patients have ended up having to have a procedure to open up their leg arteries, even with a wound on their foot, actually delayed because of a UTI that needed to be treated and at least be on the antibiotics several days before they would have the procedure to save their legs. I mean, it's a serious situation and it happens a lot.
Yeah. And so we know as we age, the bladder sits so close to the vaginal walls there, and urinary tract infections, especially in women who are in menopause, often can be attributed to a decrease in estrogen. I know a lot of urologists who will put women on vaginal therapies of estradiol so that they can help with the recurrence of UTIs and stuff. So it is important. It's important for many things.
So you touched on this a little bit, but talk a little bit more about how the modern lower dose estrogen formulations and delivery methods, things like the patches and the creams and such, how they differ from what was actually studied in 2002 that originally led to that black box warning on estrogen products.
Okay, so if we think about it in the today's current estrogen is like the iPhone and compared to the WHI's flip phone estrogens that they were using. So today we're now using bioidentical hormones and lower doses. We're using transdermal options like patches and gels, all of which have different and often safer risk profiles. So for example, estrogen through the skin bypasses the liver and has a lower clotting risk. So this could be something that, if we're concerned of blood clots, this is an option for women as well. So they still can be treated if we have this concern because we're bypassing the liver. And so it's just not your mother's hormone therapy anymore.
So is there any new specific evidence that actually led to the FDA expert panel to reconsider this black box warning? I'm sure there's been a lot of these companies that are producing these new HRTs that are like, we got to do something to get this out there and try and help women.
So the new long-term studies really have shown that for women under the age of 60 or within that 10 years of menopause, HRT actually doesn't increase, or it actually may even reduce cardiovascular risk. So that there are studies related to that. As for breast cancer, the risk appears much smaller than what we once feared, especially with estrogen-only therapy. And there's some data that even suggest a protective effect, where if a woman was on estrogen and ended up with breast cancer, they actually do better through the breast cancer treatment than they would not have ever if they had never done estrogen. So it's just a powerful reminder that science evolves and we need to update policies accordingly.
So, what does the conversation now look like after the FDA panel removed this black box warning about the risk and benefits?
Well, it really gives us permission to have a more nuanced conversation with our patients, right? Instead of starting with fear, we can start with options, right? Younger, healthier women may be excellent candidates for HRT. And now the conversation can be centered around quality of life, bone health, brain protection, and longevity, and not just these are your risk. You want to go in more informed, knowing what the benefits are as well as risk of this and a more individualized approach.
So, how does what the FDA did in removing this black box warning for estrogen delivered here in the United States, prescribed here in the United States, how does it align or not with other countries like the UK, Canada, or even Australia?
Many of the countries like the UK have long taken a more balanced approach to HRT, recognizing that for the right patient, the benefit often outweighs the risk. And in the US, it's been more cautious, largely because of that WHI fallout. Like it really changed how we cared for women in menopause. So if the FDA lifts the warning, it aligns us more closely with modern global standards and might actually help us catch up to what providers in other countries have known for years.
So, patients who are watching this right now, what should the discussion look like with their doctors, and which doctors? How do they bring this information forward? What information should they bring forward? Is it basically that, hey, I just heard that the FDA expert panel removed black box warning. What does this mean for me? I mean, and that would go for, you have the existing users of it that may be using the compounded formulas versus the ones that may have been forbidden from using it or told, no, 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 you're never going to be able to use it. It's too dangerous.
Right. So I would just say talk about whether their current dosing or delivery method or how long they've been using still makes sense. The removal of the warning really could mean more flexibility and fewer restrictions. And the decision should be a shared decision making and a very personalized approach. It's not a one size fits all. And as we know in medicine, there is not a one size fits all for anybody. So women who stop their HRT out of fear, they might even consider revisiting it because now that they have options and can really look at the studies and understand more of what is available.
So, are there any particular populations of menopausal women who would particularly benefit from this regulatory change? And conversely, are there groups that you would strongly suggest, you know what? Mm, still, I would just maintain your course.
Yeah, absolutely. Women in early menopause, especially those with like surgical menopause or premature ovarian insufficiency, they stand to benefit the most, right? Because when you have surgical menopause, it's very abrupt, or premature ovarian insufficiency happens really before the normal average age of menopause, which is around 51. So for them, estrogen isn't just symptom relief, right? It's disease prevention because when you look at the studies and the loss of estrogen further out, that's when we see an increase in cardiovascular and our lipid profiles worsen. You know, we get
Yeah.
metabolically unstable. So looking at things early as prevention. And then on the other hand, women with a personal history of a hormone sensitive cancer or clotting disorder still need a cautious approach, an individualized approach. So it just means, we need to look and see would the risk and benefits, like what is best for them. So it's not an automatic no, it's a like, let's discuss what is the best option for you.
And so I have a fun question for you. Beyond removing the black box warning, what other regulatory changes or research initiatives do you think might help improve menopause care in the coming years? Anything you're looking forward to, or anything on your wish list?
Yeah, probably more funding for menopause research, right? More education for providers, access to compounded or bioidentical options, really a better public health message to reduce the stigma. We know that there can be fear mongering amongst studies and what's put out into the media, and like really to align with what we're newly seeing. So reducing that stigma. And like, I feel like it'd be great if menopause was a mainstream health issue, right? Not a medical afterthought. Like that is something that we address and think of the whole picture of what happens when women lose estrogen. So just imagine if menopause care was normalized as prenatal care, like, you know, everybody
It's
gets prenatal care.
what really bothers me is I feel like menopause is still a bad word.
Yeah,
And it's almost, I don't know, I feel like it's a little derogatory sometimes. Oh, you're just in menopause, because when you go to the doctor and you suddenly, tell them, oh, you're having trouble losing weight, and I exercise, I do whatever. They're like, oh, I hear that from everybody. Don't worry, you're just probably got premenopausal, and they let you go. And you're sitting here thinking, you're not even listening. There's no real discussion about, okay, wait a minute, what type of exercise are you doing? What is your diet? Like, what does that look like? And maybe there's something different for you, number one. And number two is, if I do think that you are premenopausal, then what does that look like? And what steps do we need to start taking to ensure that you don't end up with the severe symptoms as many do experience, unfortunately?
right. It would be so nice to feel heard when women go into their providers. And And, you know, most of our research on any medication is done on men, right? And not females. And so with menopause, it has to be women, but there is such a stigma around it. I feel like we're getting more people who, influencers who are talking about menopause more and trying to normalize that, but we have a long way to go for sure because it needs to trickle down to practitioners and providers who understand the nuances more and how we can help our patients and how they can benefit from these therapies.
And I want to take a moment as we close out here because I think it's really important that you and I don't have any sort of financial relationship. You don't have any financial relationship with these organizations that are making the estrogen and these therapies. You're here, through the Global PAD Association in partnership with Aspire Wellness Integrative Health to provide some very real and very candid conversations and education about topics that are not really being discussed, at length. And so this is the opportunity that we have to put something that's really in depth out there for people to share. And for those people, though, that do want to learn more about this and maybe get some additional education that's more personalized, you do offer some telehealth services, though, as you're a nurse practitioner in Ohio and a few other states, but you're also a licensed nurse in other states. So you can offer some like telehealth services to some people in other areas in case they do have questions. And they can go to WIH, aspirewih.com for more information on that, right? Can you tell us just a little bit more?
Yeah, so we do offer in Ohio, several other states where I can do telemed and everything. Just getting a more nuanced approach. And I can even help guide people like who might in their area be somebody that they could speak to, especially if they're not feeling heard from their current provider or GYN. Those are the places I'd probably start. But if you're not being heard, getting a personalized approach is really important. And of course, I do natural medicine as well as like we integrate therapies. So hormones play a part into that. I have a heavy focus on health and wellness. And so, no, I don't make anything from these companies. I just believe in what there is to offer for women. And I know we've spent years not being heard.
And I think it's important for people to know that you are a cardiovascular patient as well, and you can relate.
Yeah. I mean, I was surgical menopause at 29 and then fast forward to 46 with an open heart surgery. So
So this is something deep and personal for you.
it is. It's something that I feel there's value in prevention of cardiovascular disease from this avenue. I feel like it's another avenue that women can explore to help keep themselves well.
Fantastic. Thank you so much, Nurse Practitioner Deidre. For more information, again, you can go to aspirewih.com. Make sure you do subscribe to her YouTube channel, and that is youtube.com/the @ NP Deidre, Deidre. You can also subscribe to the Global PAD Association's YouTube channel under our 501(c)(3) name, The Way to My Heart. That is youtube.com/the @ The Way to My Heart. Thank you, everyone, for joining us. Make sure you do join every single week if you want a special invite to any of our episodes where you can ask NP Deidre any question you might have about your health and supplements and diet. Anything on women's issues, you can email info at padhelp.org. And of course, we can always get you in touch with Nurse Practitioner Deidre and her team. But thank you so much, everyone, again. And thank you, Nurse Practitioner Deidre.
Yeah, welcome.